kind of half of a head. Okay, I'm trying to keep it low. But what we're doing today, a lot of people get those uneven hip because why? They might shift it, they might standing, on one leg all the time, and that hip is get elevated, and it starts shifting that the whole ilium, all those hip bones, and what happening that create that sacrum pain, SI joint pain, and the lower back pain, because if you squeeze from one side, the jelly disc is come from the other side and it's push on that nerve, and people get the tingling, numbness. So what I'm doing usually when people come to my clinic, and if you guys in Los Angeles, definitely stop by and we're going to work on you. So let me show you that hip. So what I'm find that hip, I measure first. The truly therapist is measure everything. Let's show it for the camera. Step right here and look at that. The right one. You see the difference level on the fingers? This one is higher. So that's mean he step on this foot all the time. That's why it's a hip raise. The problem is hip flexors, could be the lower back, and also hip mobility. So go ahead, so we just measure it, and go ahead, lay down face up. I want you to lay down this way, headed this way, because I'm gonna work on that, the right one, so you can see better. Okay, so here we go. What I'm doing here, I'm doing a couple tests. I do a raise legs test. Go ahead, raise up. And I'm looking for, if any, 70 degrees. It's kind of a little bit limited. Let's see if I can help and I can bring it. Yes, I can bring it. So it's maybe not the mobility problem. It's could be the motor control problem or some weakness in the muscle. We can test the muscle. Simple. I'm gonna rotate this foot a little bit in and push it down and ask him to push against me and see if it's strong. Yeah, it's pretty strong. So everything is work. It could be the adductors muscles, but yes. Now we're gonna test that hip. Remember, we need to test that internal and external rotation of our hip. Have to be 30 and 40, around 40. This is the healthy hip. So here we go. This one is 10, 15. You can see. You probably see on this camera. And external rotation is a little bit better. So why it is external? Because the hip, the bone is coming out. This is external. When you pull in, this is external. And when you pull out, this is internal rotation. Correct. Also, we can check that hip. If you see, I can try to bring this knee. This is comes up. Yeah, you see he try to adjust that pants because he think it's the pants tight. No, it's a hip. So right here. And one more thing, I use electric table. This is the beauty, but guys, always I see the therapist come in and the table too high. Now think about it. If you're going to work on that hip mobility, and the client's going to be here, you're going to be here, you're always going to shrug and get yourself injury. We don't want that, but electric table is fantastic. I want to keep my table low as possible. Low as possible. There we go. Because I want to lean with my body. And what I'm doing here, I want to get that mobility first. This arm is coming inside around that knee, and I grab it. You see right in here, I grab that knee. The other one on the top, and I'm lean on that knee with my weight, with my chest. If you're a woman, you always place some pillow or double sheet, and you push that femoral, exactly already, femoral bone inside. If it's pain, they might have some already like the joint damage up there. And always communicate. Does it feel good?
Yeah.
Perfect. So I am doing this little pull, push in, relax, push, hold, relax. Whatever my client is, if he guarding, most people is guarding, they don't trust you in the beginning. So you have to make him this in this comfortable trust zone. No ever rush. I see people come in and they start doing this. They start, and people like you feel that, see that faces, and like he started cranking, and it's not happening. He's doing more. This is exactly. This is what I watched this video. Or massage therapists start adjusting. I don't know. I see a lot of classes with people. They start doing those adjustment. Massage therapists do adjustment like. This is technique. This is adjustment. You can do that. You're not a chiropractor. You have to do 4 years, or you're gonna do 4 years in jail if you adjust someone and make a damage. So I push in and I start do rotation. You see, I'm start rotating. I'm not rotating the knee. Rotate that femoral bone inside that socket. It's that,
Wow, that's good.
yeah, that acetabular. Feels great. You see, it's increasing range of motion. He trusts me. I can give him exercise too. Right now, you see the bend on my shoulder? That's what we're going to do right now. All right, here we go. Look at that. Look at that. Is that better? I can already feel better. Look at that. We add 5 degrees, and this is great. Do I want more? Maybe not. Maybe next session. I'm not trying to help right away. I'm not trying to rush my client. I want him to enjoy this recovery. Distraction, pulling. This arm is go a little bit deeper. You see, it's on another side. This arm, you grab that arm, lock it in, and it's come on the knee. You see, it's like a wrestling style. You're going to jam. It's called lock. And you can do lock and pull. You see, you rotate and you pull. You lean back with your body. Are you working hard? No, I'm just leaning back. The body mechanic in massage therapy is most important.
It feels good too.
Exactly. That's all. Yeah, I should ask him. He already gave me the feedback. That's what I'm looking for. Look at that. And I pull. And
It's always been restricted. Always.
Great. Next one, if the client is too like a large, if you're a woman and it's a big guys, all those football players, which is I saw a couple times, the tiny girl working on the big guys, and she's so cool. She know the body mechanics so cool. She never get tired, and that's what I learned from her. So next one, if the client is big, you get this leg on the side, right in here. You place that foot between your knee, you see? And this is, I know, it looks like humping, like a dog humping each other, but that's, it's funny, yeah. Some people like, well, what about you, like if clients start kicking you up? I mean, it never happened to me, but if they kick you up, yeah, it's not going to be pleasant. But anyway, you jam that, now watch. You lean on that quadriceps. You're not pushing on that knee. You're on the quadriceps right now. And look, you can control that in and out. You see, I pushed that knee and all this shifted. Now I can do this rotation, the same thing. It's easy one. Look at that. I'm using my body. I'm lean forward. Yeah. And you rotate it. Yeah, and you rotate in, you can distract, you can pull, and like I said, a lot of people start doing this. This is adjustment. You can pull and lean and hold, a little bit distraction, jostling, whatever, side to side, but you can do that force pull. Trust me, you don't want that, okay? So here we go.
It's always been a restriction. I've never been able to do it.
If he's going to do exercise, it's going to be the great. Next one, I want to work on that hip flexors, that PSOOIS. How are we going to do this? We can, next time we have a camera guy, so he's going to push you right on this area. But what I find the navel, and I found that here ilium bone, the front ilium bone. It's right between in the middle. I'm apply my pressure. I'm not apply direct. I think the live on TikTok, they can see it. Yeah, so they can closely can see it. Let me extend you guys, and you can see what exactly I'm doing. So it's a exclusive full live TikTok live today. There we go. Look at that. So you see that abdominal? I'm not to take a short because, like I said, it's not a massage class. But if you're a massage therapist, sign up with our Patreon. There's all videos up there, full length. You can learn with the cameras, or you can visit our class here in Los Angeles. So I found that middle point between navel and my the hip bone, and I'm slowly apply my hands, not direct down, there no angle, no like no 0 degree, 0 degree left, flat, yeah, flat. And all I do, I found that very, very tense. I always communicate. You okay?
Yeah.
Feel good?
Yeah.
I ask my client to breathe. If you feel pulsation, especially it's on the left side, it's an artery up there, we don't want to push too hard and go away from this area. Okay? And what I find out, it's right in there. And if you're not sure you're on a hip flexor, on that PSOS, you just doing this and you feel that?
Yeah.
Wow, that was a big pop. Sometimes that muscle is, they kind of twist because they've been contracted for so long. Remember, this one is higher. So when you start do some action and apply pressure on that muscle, it's just pop right under your fingers. You feel that again? And it gets smoother now. Go all the way down. Why I'm doing this? I'm a little bit distract him so he's not going to be focused. Some people think I'm massaging the intestines. They scare it, and yeah, they always like, but it's a muscle. We push intestines away, and we work only on that muscle right there.
It's good. It's a good feeling.
Exactly. This is great. Next one. So I'm working on that. I can measure again. It's still a little bit high, even right here. You can see this one is high. What we need to do, we need to activate this muscle. This probably is tight. I mean, this is contracted, so it's not a lot of action up there. I will take this band. I usually take a bigger band, but this time I don't need that bigger band. So I come in inside, let it go. So it's kind of bikini line. So you can see the bikini line. I put this right on that joints close to that bikini line. Don't jam anything, okay? If you jam something, clients is not going to be happy. Well, maybe some of them going to be really happy. So be careful you're not doing anything. So around yourself, you see around, this one is not that like I said, I can pull this way without going around me, but this is the way. So you go around yourself and you around your butt, and you hold this right in this arm. Now go ahead, bring this one up. And all I want you to do up and down. He's working now on this hip flexor. Yeah, and I push to the side. Yes, you see what he's doing? He's holding this table. I don't want him to do that because he try to compensate. Something else is going to work. I want only particular that one is working. Look at that. Yeah. He said yes, exactly. Next one, I want to come up a little bit more towards the knee. Bring it up here. You can cross if you want, or just live like that. So cross, it's a cross. And I want him to do this knee in and out. And I'm apply pressure. He's working out now. Okay, if this is too much, you just give him a little bit time. Yeah. But yeah. It's only if you got that bad clients who think he knows everything. I'm usually like doing this, and he's like, oh, I can't do it. Yeah, you just make a jokes, make a fun a little bit.
But it should go further.
Yeah, I know, yeah, but it's not going right. But that's all right. If you do this for 5-6 days, it will go. This is so what he's working on here. Adductors, get that hip, glutes too. Everything is working now. Perfect. He wants to do hip flexors more. We already done this morning, but you can apply here and ask him to do this. Go ahead. Go ahead. You see what he's doing? I am here. Is that the best massage? Yes, it's the best massage because it's going to be work. He's going to be more active.
Hard.
Yeah, he's going to get up from the bed and he's going to say, oh shit, my hip is working now. Yeah.
Wow.
Exactly. Wow. This is
tired, very tired.
Exactly. So he get tired. Remember this contracted muscle constantly, it's like a weak because it's holding all the time. And when you put the pressure, when you put the power on this, it's give up. And that's what that pain is. People say, oh, it's weak. No, it's been contracted. Remember this hip is higher. So this hip flexors is contracted on that side. That's why it's pulling you, right? Okay. So next one, We already did good one. I usually finish with the pulling, but this time I want to do this pubis symphysis. So bring this up. You see this distance is probably like a fist between the foot. I get that arm inside and I ask him to squeeze. Squeeze, squeeze, squeeze my arm and relax, relax. Squeeze again, squeeze, 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 squeeze. And I start dropping side to side, side to side. Keep squeezing my arm. If a pain between in the groin area, that's a pubis symphysis. And sometimes, yes, it's painful after childbirth, especially for the woman. It's not balanced and it's create that pain. Now I want you to start turning your head to the opposite side. So I'm here and I'm start shifting here. You see what he's doing? Neurotraining. He started doing this connection. Yes, cross. It's everything work, that kinetic line. And let it go. Next one, the final one. I love to do that one. I come in on this foot. We did distractions, but this time I'm sitting. Let me show this for TikTok people. Remember, it's a special for TikTok today. Go a little bit up. Can you raise a little bit up so people are going to see more? What's your name? See more. Remember, this one was high. I'm grab this all the time. So I grab this under the heel. That's Achilles tendon. So, and you see, I can do that. If this is the bigger person, like I said, just lean back. But I love to work this way. So I'm half kneeling, get on the top, and I'm start pull that knee. I'm pull. You see? I'm holding on the top, so it's non-painful. Some people hold the foot. It's okay too, but sometimes it's painful and sometimes it's pop. Yeah, you three fingers up. Don't do this trust. Don't do those. Here we go. It's already pop. You see, I'm just lean and he breathe and it's pop. I don't do any force. I don't want that. You're not a chiropractor. Don't put yourself into trouble. And I know those people love to do all that stuff, but they doing this on TV and it's so many evidence. If you hurt someone, they're gonna say, "Oh, he did this to me." And if you don't have a license for that, you fucked. So I pull that. Now I'm asking to hip hike that hip. So basically, he's try pulling this hip up and relax. So it's kind of like penguin walk. Okay, try it again. And relax, let it go. Here we go, one more time. What I'm teaching here. Exactly, glutes get active, lower back, that hip flexors, and relax, let it go. And I distract that. Exactly. Like I said, why we need to make people put on the pain? You know, we used to have a couple people in the building. Every time I walk through that to the other people's room, I hear like, "Oh my God, oh my God, oh." People yell, screaming, and I'm like, what the hell is doing up there? Are they torching people? Is that the CIA office? Yeah? Okay. Wow. Yeah, we're going to measure that hip again, and that should be it. Let's get up, and we're going to remeasure it. Remember, always remeasure. What have you done? Is there any effect? If no effect, technique is not right. You have to do different. Good already. All right, so here we go. Without any faking it, I found this bone is right in here. You feel that? And look at that. It's even. It's even now. He can walk for 2 days like that without anything, without that shifting this way, create that lower back discomfort and pain. What I'm going to give it to him, homework. And if he's going to do this homework, he's going to feel better all the time. And less pain, less stiffness. If he's not, he choose come back to me. Perfect. Support me. Give me some little bit money. Why not? But I always give him homework and say, come and visit me twice a month. This is all you need for your body. 2 months, every other week, just maintenance, just check with the therapist. If you guys in Los Angeles, we have a lot of agents up here who can truly go to your house and truly help you, to measure you, to check your shoulders, check your ankles, everything. All right, so keep with our channel. If you need any correction exercise, if you need any help, we're here to help. And if you're in LA, give us a call. We go to your house or you come to us and we help you out. You guys have a wonderful day. Bye bye, everyone.